Assalamualaikum warahmatullahi wabarakatuh.
Hi guys, we want to demonstrate our dialogue between doctor, apotheker, patient, and family of patient. I'm Ines as a family of patient.
My name is Nisa.
AINUR RAHMAH, I am doctor.
My name Muhammad FEBRI MAULANA. I'm apotheker.
Okay, here is it.
Nah, can you help me?
Of course. What should I do for you? Wait, you look so pale. Are you okay?
My body feels bad these 2 days. It seems like a cold.
Whoa, now it's coronavirus era. You should immediately go to the doctor to check your health. Let me take you to the doctor.
Assalamualaikum. I'm Dr. Umi. What's your name?
Waalaikumsalam. My name is Ines, and this is my cousin, Nisa.
Nice to meet you.
Nisa has been flu since 2 days ago. I'm afraid something unexpected happens. So much, like we know so much news about coronavirus on the TV.
Oh, you're right. There are many patients who come complaining of cough and cough. In the midst of this condition, I'm just correct. So what the complaint is?
My throat hurts. It's hard to swallow. It's hard to take a breath, and my voice becomes a little bit hoarse. Doc.
Have you traveled out of town before?
No, my family and isolation ourselves at home.
Good. Let me take it firstly.
All right, Doc.
All right, Miss. Cough and cold are usually caused by staying in water, decrease in the immune system, and less consumption of fluid. For now, I will give you cough and flu medicine and antibiotics. Since there are no worrisome symptoms, don't forget to wear a mask if you left the house. Use a food that can be used many times, but don't be lazy to waste it. And I will give the prescription.
All right. Thank you.
For the medicine, you can take from the list. Listen here. I give amoxicillin 1 day 2 times, and for cough flu, I give you colocin 1 day 3 times. Take after getting. Later, it will be explained by the pharmacist. Future, if you don't understand it,
Yes,
Okay, thank you, Doc.
thank you, Doc.
you're welcome.
Hello, good evening. Can I help you?
Good evening. I want to take the medicine for my cousin Nisa that has been written on the prescription by Dr. Umi.
May I see the prescription, please?
Sure, here is it.
Is it true that is the name of Nisa Bima and the address is the Naru Village, Sub-District, Bima Regency, NTB Province?
Yes, sir, that's true.
All right. Wait a minute, miss. I'll get the medicine.
Okay.
Okay.
On behalf of Miss Nisa, there are two medicines. It's antibiotic and ricocin for cough and flu. For antibiotic and ricocin must be taken 3 times a day after eating. Means the patient needs to take antibiotics until it used up to even if the patient has recovered. And the ricocin, if it does not feel pain, it's okay not to take the medicine.
All right, thank you.
Don't forget to drink lots of water, eat fruits and vegetables to maintain health, especially for now. There is a coronavirus. Keep it clean and forget to wash your hands.
Yes, I'm worried about that too. Especially because of its rapid spread.
And I recommend you to use a mask if you left the house.
Okay, thank you. Maybe because I also don't drink much water and eat fruits and vegetables.
Yes, miss. I hope you get better soon. And don't forget to take the medicine regularly to get better soon, okay?
Okay,
Okay,
thank you.
You're welcome.
Let's go. Okay, guys, that's our dialogue. Thanks for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
jangan comment and subscribe.
Don't forget to like and subscribe.
Wow.
Okay, guys, bye bye.